Anatomy of the spine. The spine acts as the main support of the body. There are 33 bones that are separated into 5 regions. Those regions are the cervical, thoracic, lumbar, sacral, and the coccygeal spines. The first region is the cervical region. It consists of 7 vertebrae named from C1 to C7. C1 is called the atlas, and C2 is called the axis. Together, they connect the skull to the spine and allow for movement and nodding of the head. The mid-back thoracic region has 12 vertebrae named from T1 to T12. Each of these vertebrae are attached to the rib cage. The lower back lumbar region has 5 vertebrae named L1 to L5. These vertebrae take the majority of the weight of the spinal column. The sacral region includes 5 fused vertebrae named S1 to S5. Together, they are a solid bone called the sacrum, which attaches to the pelvis. The tailbone, or coccygeal region, has 4 smaller vertebrae, together forming the coccyx and act as attachments to muscles, ligaments, and tendons. It also acts as support when sitting. The 5 regions together support the body and provide protection to the spinal cord and nerves. Each vertebrae performs its own necessary and important task. The vertebral body is the main structure of the vertebrae at the front of the vertebra. It is shaped like a cylinder and is the weight-bearing section of the spine. The vertebral canal is behind the vertebral bodies and is where the spinal cord travels. The spinal cord connects the brain to the rest of the body through a bundle of nerves. The spinal cord ends near the L1 and L2 vertebrae and branches out into bundles of nerves called the cauda equina. Nerve roots exit out the sides of the spine, called foramina, which send signals from the brain throughout the body. On each side of the vertebrae are pedicle bones which attach the lamina to the vertebral bones. Lamina are the exterior wall of the vertebral canal. They protect the spinal cord. Coming from behind the lamina are the spinous processes, which attaches ligaments and muscles and allows them to stabilize and move the vertebrae. Out from the sides of each vertebrae are transverse processes. Muscles and ligaments attach to the transverse processes. The articular facets are the joints that allow each vertebrae to connect to the other vertebrae below or above it. 4 facets for each vertebra, 2 superior and 2 inferior facets. Cartilage covers the facet joints, making movement possible. Between vertebral bodies are intervertebral discs, which are tough and elastic. They are a buffer that allows moving and twisting of the spine. The exterior wall of each disc is called the annulus fibrosus, and the inside of the disc is called the nucleus pulposus.